Okay, last time we are discussing about a professional education, medium level education, and higher level education. So before starting the class here, I've got one video, the importance of professional education. So I'm going to share the link in your Google Classroom. All of you have a look on that video, and that video is only of 4 or 5 minutes only. Okay, so let's have a look on that video. Okay, this is the video about what is professional education and why it is important. The need of the professional education is given in that video. So you learn something from that video. What is professional education and why it is important. Okay, so tell me some point from there. What do you all remember or what you learned from there?
Ma'am, professional education help us in future that how to do different kind of profession effectively,
Yes.
and it helps to run different kind of it give us different knowledge idea about how to run different business industry nicely. And professional education um, is important because it provides different knowledge idea about about
Doing
um,
profession.
um,
We
yes
make
ma'am.
because of that professional education, we became the professional. Yes, we become the expert in that field, in that sector, because of that education. So which the sector do you want to join, we have to get education of that sector. That means you may be the expert, you will get get the skill and knowledge, so that you can do your work effectively and efficiently. That's why the professional education is important. Okay, now so today then we'll study here profession and human resources related to medical science. Okay, as you know, medical science means related to our health. So that means that's why that's why you can say that the professional, or you can say the human resources related to medical science are very important part of our life, because of different reason, because of different causes, we became unhealthy. People become unhealthy. There is imbalance in the health of the people. That's why we need the human resources who can help us whenever we have got problem in our health. So Sudeep, tell me some of the human resources related to the medical science. Some of the human resource, that means in the medical science, what type of people work there? Like, can say doctor, nurse. Okay, tell me some there. Sudeep, Sudeep, are you listening me or not?
Yes, ma'am. Can you
Okay,
please
tell me.
repeat the question, ma'am? My Wi-Fi is slow, ma'am. Can you repeat?
Same here. I try to repeat there. So you have to say the first one. Yes, you have to say
I'm
like
doctor,
yes, exactly, one doctor. Then
I'm
next,
nurse, health
nurse,
worker,
health worker. Yes,
and
physiotherapist. Yes, these all are the resources related to the medical science. So today we are going to this one topic. Thank you, Sudeep.
welcome, ma'am.
Okay, our topic is today profession and human resources related to medical science. Okay, just now we discuss on topic of medical science. Medical science is related to the health of the people. This medical science is very broad in the context. It is very broad, and it is related to the health of the people. That's why the medical professional or medical sector is very important in the human life, because people are getting different problems in their health. There are different so many regions. So our health become imbalanced. On that time we need the professional, or you can say the human resources related to the medical sector, or you can say the health. It is important for the research and treatment of health related problem of human being. This is also one of the importance here. That means they are suppose, okay, now we can give one example. Now this one is coronavirus. Yes, so we are having now this a pandemic situation, and people, doctors are trying to find out the reason, they are trying to find out a solution or medicine for this virus, for this virus. So medicine is important in every human. Okay, I can say human resources related to medical sector. Just now, Sudeep told, yeah, doctor, nurse, then after dentist, physiotherapy, ophthalmology, pharmacy, health. You can say
OBD.
what that health assistant, health workers, enemy. That these are the people related to the medical sector. Okay, at first we discuss the topic of pharmacy, pharmacist. Pharmacist, you understand, this is to the drugs or medicine. Pharmacy refers to the science of preparing and dealing drugs in medical science. So it's aimed to ensure effective and safe use of drugs or medicine for a treatment of health problem. That means pharmacy mostly refer to the not medical, medicine sector. Medicine sector or drug sector is, so its main aim is to give the effective medicine, and how to use that medicine, in which time we have to take medicine. All that thing is told by the pharmacist, the person who work in a pharmacy, the person who study the pharmacy. That is that they are known as the pharmacist. So it deals with the drugs. And next thing is that uh, it links with the, it is pharmacy, the people who work in, who study pharmacy says, they are the link between the doctor and patient, because the pharmacist doesn't give the medicine by themselves. They only give the medicine according to the doctor prescription. That's why they are the bridge between doctor and patient. Okay, given a pharmacist is a primary health professional of medical science who is expert in medicine and their use. So pharmacy means the person who studied a pharmacy. They know about the medicine and how to use that medicine, in which type of disease, what type of medicine we have to use. That knowledge is gained by the pharmacist. So this profession is the link between a doctor and patient. Just now we discussed this one. Okay, given in Nepal, pharmacy is taught in two levels. One is diploma in pharmacy and one is bachelor in pharmacy. So to do the diploma in pharmacy, you have to, there is a fixed requirement. There's a fixed you can say qualification there should be. So here given to sorry, to study a diploma in pharmacy, you have to complete at first SEE or SLC with minimum second division. Then after you have to take the diploma in pharmacy for 3 years course. That is duration of 3 years. You have to study 3 years course of diploma in pharmacy after SEE. And this is the medium level one profession. So next is a bachelor in pharmacy, or you can say B Pharma, that is studied after +2, and this is the course of 4 years. So, and even after completing diploma in pharmacy and bachelor in pharmacy, you have to take the license from the, that's what you say, Nepal Pharmacy Council. You have to take the license from Nepal Pharmacy Council. Then only you can involve in that profession. But if you haven't got the license of that one, then you are not allowed to involve in this type of profession. Okay, given the pharmacist must receive professional license from Nepal Pharmacy Council before involving in the profession. That means there are certain requirements. You have to fill the form and you have to attend the exam there. Then only you will get the license there. Then after getting a license, you can involve in the pharmacy, or you can run the pharmacy shop. So diploma in pharmacy is a medium level and bachelor in pharmacy is a higher level medical human resources. Just now we talk about this one. Okay, next year. Pharmacy has good knowledge of the formula of drugs, component of medicine, and their dosage required for treating a particular disease of the human being. So pharmacist means, as you know, that they have study about the medicine. So they know how to make a medicine, formula of making medicine. In the medicine, what things are included, components, what things are included there, and dosage means at which time, how much dosage we have to take, that is known by the pharmacy. That is their job, that is their profession. And for which type of disease, what type of medicine we should take, we have to take, that is also known by the pharmacist. And even they know the medicine, yes, their usage, but they don't give the medicine at once. They just at first they ask the prescription of doctor, then only they give the medicine. Okay, this is about the pharmacy and pharmacist. So are you clear about pharmacy and pharmacist? Pharmacy means you can easily know this is about the medicine sector, where you can they know about the medicine, how to use, when to use, and what things are involved while making medicine, and doses of medicine. That is the profession of the pharmacist, and the story of that is the pharmacy. Okay, next one is our year, nursing and nurse. I don't think I have to say a lot about this one. Everyone knows this one. Nursing and nurse. Okay, everyone knows about uh, nursing and nurse. Okay, Sunishit, tell me something about nursing profession. Sunishit, are you there? Okay, anyway. Next, I want to ask from your Sandesh. Tell me something about nursing profession.
Ma'am, nursing is the profession which is related to caring of sick people and patient.
Yes, that's good. Thank you, Sandesh. Okay, I
Welcome, ma'am.
think. Okay, once Prasanna, once say something about nursing profession.
Nursing is a medical profession that is related to taking care of patients, sick patients, and injured peoples.
Yes, good. So thank you, Prasanna. Exactly, the nursing is a profession. Yes, it is related to the medical sector. That means health sector. So their main duty, the main duty of nurse is to take care of the patients, to give medicine regularly, who can take their medicine, yes, who are hospitalized. Then the nurse take care of that patient, they give the medicine, and even they do minor treatment also. That is the duty of nursing. That means that field is known as a nursing, and the people who do the nursing, the, that people are known, those people are known as a nurse. And nurse means, so they can do the minor checkup also, and they also have got somehow knowledge of the medicine also, and the doses of medicine also they know. And next, their duty is to assist the doctor whenever doctor are doing operation or surgery. Yes, they help the doctor. That is also one of the duty of nurse. So let's see in the screen here. Okay, given nursing and nurse. Nursing is a medical profession related to caring of sick or injured people during their treatment. Yes, So the job of nurse is to take care of patient and assist the doctor in various ways during treatment. So just now we talk about this also. They give the medicine, and they take care of the patient, and they help the doctor as well. So in Nepal, the nurses are broadly categorized into enemy, staff nurse, and various degree of related to nursing. But and one enemy, staff nurse, bachelor in nursing. There are different sectors of nurses in Nepal. So here with okay, at first enemy. Okay, enemy stands for auxiliary nurse, midwife, and it is related to the pregnancy, maternal care, and child care. So enemy, this is you can see medium level profession. Medium level profession. You can study this enemy after uh, before finishing SEE also, and it is the course of 2 years, and on that time you get a training also. So it is mostly related with the pregnancy, maternal care, child care. So whenever you before SLC, whenever you got a free time, then if you take the training of this one or you study this enemy, then you also have somehow get a knowledge of the nurse. The next one is the staff nurses. Staff nurses are registered nurses, and they are employed in a medical sector. And after that also there is a bachelor of nursing. You can say BN, BSc nursing. There are so many nursing sector, but their all duty are their duty, their job is almost same. They have to take care of the patient. They have to assist the doctor. So you are given now to be NME, staff nurse, bachelor of nursing, and BSc nursing. What qualification you need and how long duration you have to study. Okay, at first you're given NME. NME just now I told after before SLC, yes, when you are reading in a grade 10, you can have a course of that one, 2 years, 5 months on the job training. Then after staff nurse, after SLC, you can join that is the course of 3 years. Then Bachelor of Nursing means after staff nurse, you have to study with 3 years experience. After being a staff nurse, you should work for 3 to 4 years. Then only you can study the Bachelor of Nursing, and it is the duration for 2 years. It is a course of 2 years. The last one is a BSc Nursing. It is also it is after done after the 10 plus 2 in science with biology. This is a course of 4 years. These are the different level of nurses in our country: NME, staff nurse, bachelor of nursing, and BSc nursing. Okay, nurse coordinate with other different professional of health sector like therapist, dietitian, medical practitioner to improve the quality of life of the people. That means I can say nurse have got somehow the knowledge of other profession also, because they are the link between the other profession. So they coordinate with the other professional, like you can say a therapist, dietitian, and medical practitioner means who are working there. They work with them also. They have got the knowledge. So that's why you can say that nurse work with doctor also and other profession also. That's why the nurse have a knowledge of somehow the knowledge of other professional as well. And because nurse suggests us what we have to do after doctor checking up, then nurse take care of us, and they suggest us what are the things good for us. This is about the nurse and nursing. Okay, next our topic is your paramedical profession and MBBS doctor. Doctor means now everyone know it doesn't mean to describe here. Okay, paramedical profession refers to the checking a patient for diagnosis and prescribing medicine accordingly. That means a doctor, like a doctor, yes, they check us, they give us medicine, and they do surgery. So that is the job of the paramedical. You can say doctor. So health assistant is a medium level human resources, whereas a doctor is a high level human resources. You can say MBBS doctor are higher level human resources, and health assistant is the medium level human resources. Okay, now to be a doctor, now what qualification do we need? Everyone know that one. Okay, to be a health assistant, yes, HA, SLC pass with at least second division, and it is the course of 3 years. The next one, MBBS doctor, 10 plus 2 in science, at least second division with biology as a major subject, or HA. Then after 4.5 year and 1 year of internship, that means around 6 years you have to study. The next one is MD. MD means for the doctor of medicine. It is a MD means doctor of medicine means there is a you can say you can say the expert one like eye surgeon. Yes. Then after you can eye surgeon. Then after bone surgeon, like different. They have to study special one. So that is a MD, and they after doing MBBS, they again join the different sector, and that is of the course of 3 years. That is of the level of the doctor. Now, doctor, I don't think I have to describe a lot about doctor here. Okay, anyway, yeah, the medical professionals, HA, MBBS doctor, and MD, doctor of medicine, should get license from Nepal Medical Councils in order to involve in their profession. So, like a pharmacy, they also have to attend exam of Nepal Medical Council. Then they will get license. Then only they are allowed to join this profession. So now job of doctor, there's no doubt. So job of this professional are to check up the patient, suggest for a diagnosis, prescribe for treatment and medicine. That means they check us, they give us suggestion what type of medicine we should take. Then after that, what we can do, what we cannot do. And then if we have to do surgery, then what type of diagnosis we can do. That all thing are described by the doctor. That is the profession of the doctor. So this is all about the doctor. Now, up to now, we have studied about the pharmacy, nurse, and doctor. Among the four, any confusion here? So up to now, we have studied about four human resources. One, pharmacist, then nurse, then after doctor. Among these four, any problem, any questions here? So last time,
Yes, ma'am.
in the last classes. So in the last class, we study on the topic of medium level and high level profession. So today we are talking about the human resources or the profession of the medical sector. That means in the medical science, in the health sector, what type of professions are there? We are discussing on that topic. And up to now, we have discussed about the pharmacy, or you can say pharmacist, then after nurse, then after doctor. So pharmacy means it is related with the medicine. Yes, pharmacists have got knowledge about medicine, doses of medicine, components of how to use medicine. Yes, what things are by which component the medicine are made, and for which disease, what type of medicine we have used, all that things. They are expert in the medicine pharmacists. The next one is a nurse. Nurse means yes, there is a you can say enemy, staff nurse, BN nurse, BSc nurse. There are so many degrees of nurses in Nepal, and for that you have to study or you have to study. You have to finish one fixed requirement there. After plus two, after SLC, you can join that sector. And the main job of nurse is to take care of the patients, to give medicine, and to help the doctor as well. So and then next one just now we study is the doctor. Doctor also, no doubt, almost all of you understand what is the role of the doctor in the human life. And there are also HA, MBBS doctor, and MD. That means medical. You can say doctor of medicine. That is a MD. Doctor of medicine means expert in one part of your body only. That after doing MBBS, if you want to be a suppose if you want to be eye surgeon, then again you have to study on only eye on for 3 years. That is the MD. So up to now we have studied here three human resources. So among them, any confusion here? Otherwise we can start here. Next one is the ophthalmology. Okay, first tell me what do you mean by ophthalmology? Ophthalmology and ophthalmologist. Ophthalmology means related with your eye. That means you can say eye surgeon, like you can say dentist, related to our teeth, mouth, cavity. Yes, dentist. Then you can say next one just now. Yeah, physiotherapist. Physiotherapist means that is also a doctor, but they treat us by giving massage, by giving exercise. Yes, by giving some electric shock they use to treat the disease. That is a physiotherapist. I think our time is almost going to over, so we will discuss ophthalmology, dentist, physiotherapy in next class.